Hello, everyone, and welcome to today's webinar on COVID-19, hosted by the International Society for the Prevention of Child Abuse and Neglect. In a matter of weeks, COVID-19 has severely disrupted the daily life and routine of families and youth across the globe, causing a major sense of threat and unpredictability. Youth with histories of trauma and those coming from disadvantaged families are at higher risk of developing adverse psychological reactions and are now even more vulnerable to further abuse and neglect. Today, Jessica Griffin and Zlatina Kostova from the University of Massachusetts Medical School Child Trauma Training Center will discuss the risk factors of the current crisis on youth and families, the challenges that professionals are facing, and strategies and best practices to manage the emotional impacts of COVID-19. Right now, I have everyone on mute to avoid background noise. We welcome you to enter your questions and comments in the questions box throughout the presentation. The presenters will answer questions at the end as time permits. Jessica Griffin is an associate professor of psychiatry and pediatrics at the University of Massachusetts Medical School and is the executive director of the Child Trauma Training Center. She is a nationally recognized expert in trauma-focused cognitive behavioral therapy and as director of the Child Trauma Training Center, has overseen training of more than 18,000 professionals in trauma, trauma-informed care, and trauma-sensitive practices. Zlatina Kostova is a licensed clinical psychologist and researcher affiliated with the University of Massachusetts Medical School Department of Psychiatry. She has a multidisciplinary background in clinical psychology and with particular interests in childhood trauma and mindfulness-based interventions. She is certified in TFCBT and other therapies and is a certified trainer for teaching trauma-informed curricula. Jessica and Zlatina, we thank you so much for being with us today and for sharing this important information. I'm now going to turn it over to Zlatina for the presentation.
Thank you, Heather. I hope you can all see my screen.
Yes, it looks good.
Thank you everyone for joining today's webinar. Again, it's a real honor to be here again and to have this international audience and also to be able to present with Jessica. And today our goal is really to present this webinar as a way to help professionals who are working with youth and families who are impacted by trauma, who might be part of child protection services or the child welfare system, and really to give some suggestions how to face some of the challenges that we are all having right now in providing services, in providing therapy, and also to give some clinical suggestions to therapists. So we will start talking about the risk factors and why this pandemic right now is sort of such of a risk factor exactly to that population that we are working with. We are talking about the challenges that professionals are encountering right now. And as I mentioned, we will focus mainly on some strategies that can be useful for you to face these challenges. And also particularly, we'll talk about some of the clinical interventions that could be done by telehealth, how to do them, and what might be helpful. So I know that we have people joining from all around the world, and I think that unfortunately we have been already some months impacted by this critical situation. And so for all of us, we are in the middle of one of the most extraordinary and cataclysmic events in our lifetimes, I think. Something that we will remember forever and that has no parallel in the recent past. And this is not just a health crisis, this is a human crisis. Our sense of daily routines has been completely interrupted. And the majority of us are really living with this sense of unpredictability, threat, and uncertainty. But I also think that one of the most challenging and difficult questions that we're having right now is, how long is this going to last? And is life ever going to be as before? For those of you who followed the webinar from last week from Dr. Fallon and Dr. Colin Vidzina from the University of Toronto, we can see here this socio-economical ecological framework that we can use when we are thinking of the impact of COVID-19 on those youth and families who are already coming from disadvantaged situations, who are already perhaps living with a lot of trauma around them. And we can see that the impact of this pandemic is really going on a multi-layer. So definitely the kids that we are working right now, they are at higher risk of abuse, of neglect, of violence. And this is because within the families, there are a lot of family separations. Those families who are really relying on social support services, now there is a reduced access to those services. There is much more stress and therefore much higher risk of domestic violence and abuse. The pandemic also impacted our families and all of us really also at a community level. Actually, every person, any person outside now, it's perceived as a real threat of infection. Many of the services, as I said, are closed. There's no access to education services. Schools are closed, to playgrounds. And also COVID-19 has a huge impact in terms of erosion of the social capital. And when we look more closely at the numbers here in the United States, and of course, if we think of those numbers in terms of globally, including all over the world, they will be much higher. But just focusing a little bit on knowing that there are currently 440,000 children here in the US living in foster homes, which means that probably these are kids who are not able to see their biological parents or their siblings. 43,000 are the youth living in juvenile justice facilities, which means that they are at higher risk of infection. 2.8 million are those living in the care of grandparents, and we do know that grandparents and older adults are at higher risk right now. We know that 5 million children are living with at least one unauthorized immigrant parent, meaning that probably they don't have a health insurance coverage, or maybe these are parents who have been working in those industries that were hit by the pandemic. So we can see all these different populations, how much vulnerable they are, and actually how big is the impact of COVID-19 on these type of people and clients that we are really working with. And so we know that those professionals who are working exactly with these vulnerable children and families right now are under a considerable pressure in really providing the continuity of care and the quality of care that we're used to. So we identified some challenges that clinicians are facing right now in this period of time. And those challenges are, first of all, the quality of the session. So many clinicians are concerned around the quality of their work right now. A lot of concerns around kids who are at risk. Concerns around inpatient and residential settings or the policies around there, the telehealth, and also working from home, really how to find this right balance in working from home and dealing with the family. So talking in terms of quality of sessions, a lot of clinicians are concerned with not being really able to see their clients in person. And we know how frustrating this could be, especially in some specific moments of therapy, such as the initial assessments or terminations. And really, there is something much more different when we see our clients in perfect and we are able to assess for affect, which we know is one of the main factors for psychotherapy. We're more able to emphasize with them and to read body language. Some other concerns are the difficulties of clinicians to engage with kids over telehealth, and it's already difficult to engage with kids when we are in our offices. So right now it's even more challenging. We may have the kid who is snacking and then talking to their parents and then remembering that you are on the phone. Another big concern is around privacy, especially those kids who are coming from more chaotic environments. Right now, they might not have really the space where they can do therapy with us. And here I'm talking mainly about those clinicians and those professionals who are working from home right now in outpatient settings, perhaps. But for those of us, for example, who are following some manualized treatments where the trauma narrative is really important, such as the case of TFCBT, trauma-focused cognitive behavioral therapy, we may not have the possibility to get really deeper into the therapy. And so many clinicians are afraid of the deterioration of their sessions. We had a clinician here that was saying, I don't know how long I can keep talking about Netflix, because in some weeks, maybe I'll lose my client. I don't know how long I can do that. And of course, fearing of losing clients. There are also a lot of challenges and worries about those kids who are at higher risk right now. So we know that when parental unemployment, parental exposure to substance abuse goes up, we know that also child abuse goes up. Nevertheless, these are some data that are coming from from UMass here. We know that currently there is 75% less reports for child abuse and neglect compared to the period before the pandemic. But that doesn't mean that those kids are not experiencing any neglect or any abuse, but that means that there are no really eyes on them. There is no the school teacher who can see that. There is no the social worker or the clinician. And it's really interesting to see that in our pediatric services here, who are specifically focused on kids who are part of child protection services, there are much higher reports on severe physical injuries. And there is also less consultation and supervision around those difficult cases. Those of you who work in inpatient and residential settings, there are also a lot of challenges around that. First of all, you as a clinician, you may feel more anxious and worried about your own exposure when you have to go into those units and face all the clients there. But we also see a lot of aggression, a lot of behavioral problems in the youth right now who are in inpatient settings. I was talking to the director of the inpatient units here in our state hospital, and he was sharing that right now they have more than 15 restraints a week, which is much more compared to their normal levels of restraint. So there is a really huge impact right now also in those residential settings. There is a lot of also frustration around telehealth. Some clinicians may not feel familiar and practical with technology, as well as many of our clients too. It is interesting to see, these are data coming from our outpatient ambulatory services here at UMass, that 32% of patients choose video versus audio sessions, which means that still the majority of our patients prefer audio sessions. Some of the platform systems that you may have to use could be unstable, group therapy could be limited, and some families do not really have phones or computers right now. And another of the challenging factors that we identified is really this ability right now to juggle work from home. Most of us have a family that they have to take care of, and so really finding this balance between working from home, taking care of your family, and taking care of yourself can be really stressful. And there is a sense of not having those boundaries really in place between work, between family time, between time for you. So now in the next slides, we will talk more about what could be some of the strategies and some of the suggestions to face those challenges. And I will turn it now over to Dr. Jessica Griffin, and then I'll be back again later.
Okay, thank you, Zlatina. All right, bear with me. Can folks see my slides?
Yes.
Okay, wonderful. Well, good afternoon, everyone, or good morning to some of you, good evening to some of you. My name is Jessica Griffin, and I am delighted and honored to be here today to talk with everyone. And we're going to talk now a little bit about strategies and ideas in how to manage and help to support children's emotional health during this time. And we'll try to lean on science as much as we can, although we know none of us have ever gone through anything like this, and science can only tell us so much. Funny enough, we were going to be part of a larger pilot study looking at trauma-focused CBT via telehealth, and that was before the COVID-19 pandemic hit. And now we are all been learning part of one larger pilot. And one of the things I'm very grateful for is just hearing from so many professionals that we work with, and our center's trained over 35,000 professionals. So we're talking with folks on the phone and over Zoom constantly, and are learning so much about the ways in which we can still reach children and families and still have that connection. And I'm also grateful for those who have the technology to be able to utilize it now in this way. So we're going to, speaking of science, lean on what we know about science and in supporting children's health. We can go through a stressful experience, all of us, and it can impact us all in a number of different ways. And some stress can be positive, as many of you know, studying for a big game or you're doing a presentation, that stress response that the body has can be positive and get you motivated and able to perform better. However, that goes away. Tolerable stress is when there is a serious activation of the body's stress response system, but it's buffered by supportive relationships. So this may be the death of a family member or a car accident. But that stress is tolerable and it's buffered by those supportive relationships. But lastly, when a situation is stressful, it can become toxic to our system when there is the absence of a supportive relationship and supportive relationships. And so, in the irony here is that we're protecting our physical health by socially disconnecting. And so we want to make sure we do whatever we can to maintain connections, whether those be connections in the home, but also connections outside of the home, using whatever creative ways we can do that, because at the end of the day, it's those relationships that really need to be prioritized. And so thinking about professionally, how are we supporting the relationships that youth have? So our top priority really needs to be thinking through what we know about just the science and recovering after disasters, whether it be, terrorism, war, natural disasters. There are a number of resiliency factors that emerge from the literature. The first of those is just ensuring basic needs. So when we're working with our clients and making sure that those basic needs are met and connecting them with services when we need to. Second part is really taking care of caregivers. Now with the stay-at-home orders in so many places in our country and around the world, the pressures on parents are astronomical, and trying to balance working from home while you are also caring for your children, and the pressures that parents feel having to homeschool is really taking its toll. And we know that the stronger that caregiver-child relationship is, the greater the buffer to that potentially traumatic situation becoming stressful to the child. So making sure that when we're connecting with families, we're spending extra time talking with parents around how they're taking care of themselves. Social connection. So social connectedness is a strong resiliency factor, and that is challenged with a lot of the limitations that we have on us right now. But there's still ways to socially connect. And some of you, and I've heard so many stories about ways in which people are feeling more connected because of what's going on, as far as connecting over with friends they haven't talked to in some time. So there are ways to creatively socially connect even in the midst of all the limitations we have. Increasing self-efficacy. So we're going to talk about different skills, strategies that kids can use. The more their self-efficacy, the higher the self-efficacy, the more resilient they're going to be. And what we mean by that is, what are the things that I can do that are within my control? Right? What are the things I can do, whether it's hand washing, there are skills I can use to help calm my body down, to be healthy, to be active. So what are those skills? And I'll talk today also about the 3 R's: reassurance, routines, and regulation. And then lastly, making sure that no matter what, we continue to provide hope. And when we have hope, we are more resilient as people and as a society. All right, so what we want to do first, especially in how much things have changed with the way we're connecting with our clients, is just reestablishing that therapy is going to look different, accepting those limitations, being transparent. A trauma-informed approach is one that values transparency. So you might say something like, listen, this is not ideal for us to be communicating via telehealth or video right now when we were seeing each other face to face, but we're going to do the best that we can. Initially, it may just be checking in. How are you doing? That's fine. You want to take the pressure off yourself to have to pick up exactly where you left off at your last session for clinicians. And then the goal for treatment, we prioritize the continuity of their care, but how are they managing stress? How are they coping? Do they have adequate coping skills in place? And then we're also assessing for physical and psychological safety. Right now our thinking is, it's better that we're doing something rather than nothing, where, we get questions about, well, what about the telehealth approach and how do we know? And, the idea right now, at least the way I think about it, is I'd rather use that approach than have no contact with clients at all. And then determining where they are now. Some of our, as you know, some of your clients are doing okay, and others are really struggling. And so letting that inform your plan for moving forward. We want to check in with kids. How are they doing? Tell me about the good things that are happening in your day. And then knowing that we will also serve as an emotional container for youth. Part of the first check-in sessions may just be, how are you doing? And acknowledging, validating feelings that they have about, yeah, this is a really tough thing that we're all going through. And again, we value that transparency. On the positive side, I talked to hundreds of clinicians already who are doing this work, and I hear so many stories about, listen, I had an adolescent who was able to open up to me in a way that she hasn't when we've met face to face. I had a clinician yesterday who talked about feeling more connected to some of her kids that she meets with over telehealth now. So, which a number of these have been surprising to me as someone who really values the relational aspect of the work that we do. But it's been wonderful to see that we've had so many success stories already about clinicians who are doing trauma work going really well. When we're keeping those sessions on schedule, we send that message of care, signals of care and safety. It can be part of the routine that we know is also important. The telehealth also allows us to see other aspects of the youth. And so for those who already do home-based therapy, you know what I'm talking about when you're able to see in their homes and what daily life looks like. But for many of us who are practicing outpatient settings, we don't always get those aspects. And so you may have the child with the iPad who's walking around giving you a tour of their home after they get over wanting to show you up their nose for the first 5 minutes of the session. And I know many of you know what I'm talking about. And for families, it may cut down on some of the access issues. If they do have access to these resources, it may cut down on access issues as far as having time in their day, et cetera, to schedule this online. Therapists may have more time to work on their own productivity as far as note taking. And we can use the coronavirus or COVID-19 pandemic as an opportunity to practice some of the skills that we may be teaching youth in our therapy sessions, emphasizing, and we've had so many stories and from clinicians and others about how we're all in this together, with folks sharing resources and really just so many wonderful collaborations where people are putting their heads together to figure out where do we go from here. Just a few things about telehealth. And again, we are all part of one giant pilot, and I have learned so much in these last few weeks about this particular modality, as many of you have. So you want to make sure, if you haven't tried this yet, try it out first, test it with someone else before you try it out with your client. And pick the platform that you feel most comfortable with, whether it's Zoom, other platforms, GoToMeeting, etc. You want to make sure it's one that your agency obviously approves. Be flexible. If they prefer audio, you'll do audio. You may find yourselves texting more, etc., making sure that you're still getting those releases and consents verbally over the phone. And then know that we may have some clients who want to continue to do online sessions once we're out of, we're no longer having to socially distance ourselves. All right, and then as you set this up, you want to talk about a private space with the youth that you're working with and their caregiver. So it may be that they have to find a place in their home that they can talk to you in. I had one clinician who the child said that they didn't feel comfortable talking in their bedroom. So I thought that was great that the child was able to say that. So ask them, where do you feel most comfortable talking to me? Let's find that space. Let's make sure it's okay with whoever their caregiver is. If they have access to some sort of white noise machine, you can use an app on your phone. You could turn on a loud fan or air conditioning unit so that they also feel that the space is private for them. Encourage them to do that as well. And this may be, you have to involve caregivers to set some of this up, making sure that you're also letting parents know that this is not babysitting either. I had a clinician earlier in the week who the mother had come into the room with a grocery list and said she was running to the store and she'd be back in an hour, and the clinician had to quickly address that. So making sure that you are just discussing the limitations of this with parents too. You want to operate in a neutral looking and sounding setting, and make sure you dress professionally. And I know many of us are wearing professional clothes on top and sweatpants on the bottom, and I think that's perfectly acceptable. And knowing that, as someone who's working from home, you may also not be able to control your own environment to the degree that you want. I was doing a Zoom call with a number of colleagues, and my 6-year-old, my youngest child, came into the room wearing only his pajama pants and a jar of Nutella in one hand and a spoon in the other, with it all over his face, and asking if he could put the spoon back in the jar. And that's the kind of things you just have to roll with it and move on, because we are all in this together. Supervision and consultation, so making sure that you are working with, if you're in a supervisory role, having regular supervision with your supervisees. And on the flip side, if you are under supervision, making sure that you are connecting with your supervisor on a regular basis, or looking for consultation in how to best do telehealth and how that's going, so that you have additional supports as well. Okay, so next I want to talk about the 3 R's. And so if you can remember anything from today, these are, I think, 3 things that I think are so important to come away with when we think about how to support children in stressful circumstances, and how to support people, really. So it's reassurance, routines, and regulation. At the end of the day, we know that children need to be reassured, and sometimes quite frequently, that they are safe, that they are loved, and that the people that they are taking care of them are doing everything that they can to make sure that they are safe. And letting caregivers know that you may have to reassure them more than once a day, and just letting them know that they're safe. We have food here. There are things that people are doing everything they can to try to figure out how to make sure that everybody is safe and healthy. Right now, in the midst of this pandemic, we personally can't be reassured that everything's going to be okay. It is an unbelievable time for our world right now, but we can reassure our loved ones that we will be there for them, period. And so that reassurance, I'm going to be here. We are in this together. We're going to get through this together. This might be hard, or there may be some adjustments, but we are going to be through this together. So reassurance, routines is the second R. And I want to make sure I'm very clear about this, that we don't want to be so rigid about the routines that it's at the expense of the relationship. So I hear from so many parents that they feel overwhelmed by having to homeschool their children. And we shouldn't even be calling it homeschooling. If we called it home surviving, I think that might take some pressure off. So we don't want to have a situation where from 10:15 to 10:45 we're doing X, and then at 10:45 we're doing this, where parents are so stressed out by having to maintain that schedule that it ends up negatively impacting the relationship or causes tension in the relationship between them and the child, or the child's engaging in battles with the parent about not wanting to do the routine. So thinking about routines, we want to be somewhat flexible, but routines are really those rhythm, structure, predictable moments, and those predictable moments can build that sense of safety, which I talked about being so important with reassurance. And so again, it's not about rigidity, it's about co-creating the sense of predictability. So it could be helpful if you start with natural times that are already in place. So waking up in the morning, having some sort of morning routine, making sure you're eating your meals together, having a routine at bedtime, but establishing these routines that are at predictable times of the day, or maybe times where things start to get a little haywire. And so we often hear bedtime is tough. So why don't we start with a bedtime routine? And it doesn't have to be anything too difficult, but bedtime could be we turn the lights down, we read a book together, we sing a song, and we go to brush our teeth and go to bed. But having some sort of routine, getting up in the morning, we wake up, we take a family walk together in the morning, establishing some sort of routine. And then also an opportunity to create new rituals, new traditions, and those can also be helpful in calming for children. So again, it's that routine, that sense of predictability that's key for healthy development of children, but it also helps. We know that routine and structure can be calming in the midst of chaos, and that's what we're really trying to instill. Also, for professionals, thinking about routine, trying to stick with the same day and time of sessions, having a semi-structure of the sessions, and it may be that the first part is just checking in, talking about how they're doing in the midst of this crisis. And regularly connecting with caregivers, but making sure that we're also keeping that routine as part of our practice. And then the third R is regulation. And regulation is, we address this in a number of different ways. First, we're addressing it through their affective regulation. So talking about feelings, helping them expand their feelings, vocabulary, express their feelings more effectively. And then there's other regulation activities that involve relaxation and stress management activities. And part of the reason why we focus on feelings is that when children don't have adequate feelings vocabulary or way to express those feelings, they may be more likely to use maladaptive strategies. So part of the way in which we can teach feelings is to just talk about them. For parents to model this for kids, for clinicians to model this for parents, I want you to intentionally express feelings words 3 times a day, and they can't be all from the same category. Like they can't be all angry, mad, and rageful. They need to be, I feel frustrated by this situation. I felt so proud of myself that I got up and did that exercise class this morning. I felt really, my heart was full and I felt happy that we were able to watch that Disney movie together last night. So have parents intentionally express their feelings. You can help to model that for children as well. And relaxation and stress management activities, and Zlatina is going to get into many more of these after I turn it back over to her. But could be things like meditation, mindfulness, just taking walks, listening to music, knitting, doing yard work, yoga, or just stretching the body, breathing exercises, and encourage caregivers and kids to come up with their own relaxation menu, knowing that what's relaxing for one person might not be relaxing for someone else. So you may hear, oh, it's relaxing for me to clean or to cook. Someone else may say, no, that's so stressful. So it really needs to be individualized. But one of the things we can do with our clients is help them develop a relaxation menu for them, or stress management menu, and encouraging them to do a number of those activities a day. And that could be something that they build into one of those routines or rituals together. All right, and so again, there are so many different feelings worksheets that are out there, apps and games, but just talking about helping children be able to name the feelings that they're having. You can use the COVID-19 pandemic as an opportunity to practice a skill, but encouraging them to share those feelings. Come up with a list of feelings. What on here could you circle that is reminding you of your experience right now? Does this situation make you feel down or depressed? Is this making you feel furious? What are the feelings that come up for you? Not being able to see your friends. And then another strategy that we can use is called the cognitive triangle. And some of you may be familiar with this, but the idea is that if we change the way we think about a situation, we can change the way we feel, change our behavior, and even the way our behavior impacts other people. And so the way you could do this, so the situation is for many children, I can't go to school because of the quarantine or stay-at-place order. And the thought might be, I'm missing out, I'll lose my friends, et cetera, et cetera. You could have probably 100 more thoughts there that are either not helpful or inaccurate. And then those feelings related to that thought are, I feel worried, I feel angry, I feel sad. And if you're feeling worried and angry and sad, then the behavior might look like lashing out at their foster parents or whoever's in that caregiver role. So what you can do is help kids see that if you change the way you think about a situation, you could potentially change the way that you feel and what your behavior looks like and the way other people behave toward you. So for example, a new thought could be, I get a chance to spend more time with my family, or I have more time outside, or I will see my friends again. You could add to that list with many more thoughts. The grown-ups are doing everything they can to make sure that we're okay. And that new thought then is related to new feelings, I feel more appreciative, relaxed, content, happy, and grateful. And if you're feeling those feelings, then your behavior is likely to be more proactive. Maybe you write a letter to your friends, maybe you get on FaceTime with them, etc. So cognitive triangle is a therapy tool that could be utilized in a number of different situations when our thinking is impacting how we feel and what our behavior looks like. You can also take this to the next level and do what we call the cognitive diamond, which is where you have a thought, feeling, and then before you get to behavior, it's what feeling do you have in your body? So you're helping children identify those physiological symptoms they have related to feelings that they're having and their behavior. So that's the cognitive diamond would be another approach. For young children, you could do head, heart, and hands. Instead of thought, feeling, behavior, you could do head, heart, and hands. All right, so I will end it there with the cognitive triangle and turn it back over to Zlatina for some more tools here.
Thank you, Jessica. So probably most of you are familiar with this visual, which I think it's really a great way to understand a little bit what do we mean by regulation, and what are some of the things that we can do to regulate kids and ourselves really. So this is a diagram showing how trauma can affect your window of tolerance. And again, I'm sure some of you are probably familiar with this, but we know that traumatic experiences can really shrink our window of tolerance. And our window of tolerance is simply where do we feel most comfortable? Where in our body? What is the level of our body energy or the situations, the circumstances that we feel most at ease, we feel most safe, and more able to cope with the situation. And we know that, again, with kids with trauma, with families who are coming from disadvantaged situations, that window of tolerance could be really small. And then what we see in kids is that they go into two extremes. So we may have the kid who goes into a reaction of hyperarousal every time that there is a stressful situation. And by hyperarousal, we mean the kid who is anxious, angry, out of control, overwhelmed. Or we may have other kids who are reacting in a way that we call hypoarousal. So the child who is more spaced out, zoned out, numb, frozen, even dissociated. And with regulation, what we want to really do is to make this window of tolerance bigger so that kids don't feel that they have to go into that hyperarousal or into that hypoarousal state as a way to protect themselves, but that they can feel more comfortable into moving into this bigger space of sense of safety, psychological and physical. And so I'm going to share with you a tool that I personally developed with the team of an inpatient child unit in one psychiatric hospital affiliated with UMass. And we developed this tool based on many things that are already out there. So probably you are already familiar with it, with this idea of the feelings thermometer. But we used with this tool with kids who were hospitalized, and we used it in a variety of ways. But at the end, it turned out to be really an amazing strategy that was very helpful for children to take a perspective over their feelings, to understand what are some of the signs that are in their bodies, in their minds, and that are ways to understand what they're feeling, and what are some of the coping skills that they can use. And I think that this is something that you can use even now remotely for families, and it involves really also the caregiver. So you can see here this, and this is literally the handout that we will give to the child. And there are many faces on the bottom, as you can see. So the way that I do it is I am asking the child first, okay, so tell me, what is the most difficult emotion that you are struggling with it right now? So let's say in this case, the child says anger. And then the idea here is to explain to the child that even if sometimes emotions feel really intense and they feel like they're just so immediate and they come from 0 to 10, the idea here is to explain to the child that there are a lot of levels that these emotions are increasing, and that if we can catch a certain emotion at the beginning, it is much easier for us to manage that emotion. And so I first asked the child to focus on the blue zone of this worksheet and on the bottom part of the thermometer. And I simply asked the child to tell me what are the things that they do when they feel calm and safe and relaxed. And so we are teaching the child here again that there are behaviors, body sensations, and thoughts that might be a very important indicator for them to recognize their feelings. Then we move on and we ask the child to tell us, now think about when you are angry, when anger is just starting to hit in and you are in that middle stage. So what are some of the behaviors? What are some of the things that you start doing when you start to feel angry? And again, some of the examples might be starting to pace around, not talking much, staying more in my room. Same thing for body sensations and thoughts. And then at the end, we are asking the child to think about the situation when they were really angry and out of the roof. And again, to identify what are the things that they usually do, what do they feel in the body, and what are their thoughts. And then the next page, which is basically the back of the same working sheet, we are asking the child to think about what are the things that they can do by themselves independently to calm down when that anger is in that middle stage, when they just start to feel angry. And again, here we are helping the child to write down, and you want to be really detailed, to write down what are some of the things that they can do. So in this way, we are increasing also their sense of self-efficacy and control. And then they can also share this with their caregivers, because we know that caregivers play a fundamental role in the regulation of the child. So the caregiver will do their own part and write down what are some of the things that they can do according to the child. Same things when they are at the red zone. And something that we also included that we thought is important, you can see on the bottom left side of this sheet, is what are some of the things that other people shouldn't do? We know that sometimes parents, caregivers, adults are doing certain things with the intention to help the child, but actually they're triggering the child even more. And so again, we're helping the child to identify and communicate with their caregivers what are the things that they shouldn't do. So I can talk more about this later, but again, this is just a simple tool that it's incorporating a lot of different strategies of affect identification and affect modulation. Now, we talked a little bit already about this idea of the internal alarm system, but what is really important to think about right now is that this situation of the pandemic right now, it's really impacting the internal alarm system of the kids and families that we are working with, and also our own. And usually when we are in front of a dangerous situation, our brain will release some hormones that will activate our body. And so we may get into this fight, flight, and freeze reaction. But when the threatened, let's say the COVID virus, disappears tomorrow, our senses are getting back to normal. Unfortunately, what we are experiencing right now is what Jessica explained earlier around this idea of the toxic stress. We are in a situation that we are living in this constant sense of threat and constant sense of uncertainty. And what is happening is that our internal alarm system is constantly on alert. And especially for those kids who are coming already from situations of chronic trauma, they might be much more jumpy, much more activated, because again, their internal alarm system is activated. And so, as we know from the literature, a way to calm down the limbic system of the brain, a way to help children regulate their emotions, there is a lot of research around this, is through mindfulness and relaxation skills. These are some of the main books that I have been personally using in the last years. We did a research on implementing mindfulness-based cognitive therapy for children, which is an evidence-based treatment for children who may experience anxiety, depression, but also other mental health conditions. And we implemented this treatment in inpatient youth who are severely impacted. Another resource is written by Randy Semple and Christopher Willard, which is just Mindfulness Matters, and you can find a lot of different mindfulness activities there. And then there is this book, Alpha Brats, again written by Christopher Willard, who is a clinical psychologist and a guru in mindfulness. So we'll see some of the interventions of those books below. So this is an intervention that you can use. It's called the 3 minutes breathing space. This is a working sheet from the mindfulness-based cognitive therapy for children. And this is a very simple and brief type of meditation that you can use with kids, even over the phone. And it's really about 3 main stages. So in the first stage, we are inviting the child to really check in what it is there, what it is here for them right now. What are the thoughts that are in your mind? What are the emotions? What are the body sensations? Step number 2 is redirecting the attention towards the breath. And then step number 3 is again enlarging the focus of attention and including the body as a whole. Of course, mindfulness is one of those things that we want also to practice it first before doing it with the kid. But these could be really a very simple activities that could help the child to regulate, right? When I had that stressful situation, what are the body sensations, what are the thoughts, and what did I do? So you want to help the child understand that they can use their coping skills here. We can do the same thing with pleasant events. Now in this next slides, I will show you some interventions of this book, Alpha Breaths, which is an amazing resource also for younger kids. And these are really very simple illustrations of different breathing activities that are really easily accessible for children. This is an example of an alligator breath. You're inviting the child to open their arms wide up and then to let them snap down. Or for example, the chocolate breath. So breathe in and smelling and breathe out and cooling out. And you can ask the child to imagine that they're holding a cup of hot chocolate, or they can even have a hot chocolate. This one is personally one that I really like, the ice breath, and it's nice because it includes also this idea of using the muscles. So you're inviting the kids to breathe in and tense all the muscles, and then breathe out and let the muscles melt. So in this way, you're helping them to understand the difference between how do we feel when we are stressed out and when we are relaxed. The kind wishes, this is also a great way, I think, especially right now during the crisis, to invite the child to practice mindful breathing with the idea of sending out wishes to other people. So you can invite them to breathe in and think of someone that you want to send the wish to, and then breathe out and sending that wish to your friend. And you can invite the child to do this for friends, for parents, for the community itself, or for themselves. The glitter jar is another interesting intervention. Again, it's helping the kid to identify different emotions, and it's a great way to represent also what is mindfulness. And progressive muscle relaxation, I really like the script from Monica Fitzgerald from a TFCBT training. And I think you can use a lot of images and be really creative here. And again, with the idea to help the child tune in into the body and feel what does it mean, how the body feels when we are stressed and when we are relaxed. Grounding skills, again, these might be very important, especially for moments of dysregulation. So we can think about sound, touch, smell, taste. These are just some examples. But also some motor strategies for those kids who regulate themselves when they are running, when they are jumping, when they are exercising. And for those kids who are at risk, this is just a template from the safety plan intervention that was developed by Stanley and Brown. And it was initially developed for adults with suicidal ideations, adults who are at risk of suicide. Unfortunately, it hasn't been adapted for children, but this is just an idea of something that you can use with kids who might be at risk, and not only with active or passive suicidal ideations, but also other types of risk. And it's just a real way to kind of be detailed and identify what might be some of the resources and people that they can contact. And now, last but not least, and here we need to give probably another webinar around self-care. And we know that you, as the professional working right now in this period of time, there is an unbelievable stress around the way that you have to do your work, but also to juggle that work from home. And so it is really important to think about, what does self-care means for you? What are the things that you can do in order to feel better, in order to take those moments during the day that can help you to breathe through your own oxygen mask? And so, for example, things as providing hope. There is something really powerful into sharing stories about how people are coming together and helping others. Thinking and talking about what you're grateful for, and really remembering that we are all together in this right now, and we are experiencing what does it mean to be a human being, and that you also have the power to make this time what you want it to be. Now, we put some resources for you, and of course there are a lot of things out there, but we selected certain things that have been definitely helpful for us. So thank you so much. I'm gonna end here and give some time for questions. So thank you.
Yes, thank you so much, Latina and Jessica, for sharing all this very timely information with us today. If you don't mind, Latina, we'll leave this slide up for just a moment so people can see your contact information.
Sure.
I do have a few questions. We'll try to get to some of them here. Many people are very interested in all of the wonderful resources you shared. Are most of those publicly available if people want to find them that way?
Yes, I believe all of our resources are publicly available, and they'll be able to access this link or slides afterwards, Heather.
Yes,
Yeah.
we will make sure, yes, for everyone listening, the slides as well as a recording of the webinar will be available on the ISPCAN website as soon as we can get it up. So, so let's try to answer a couple of these questions. One attendee was asking whether you know of any tools for assessing how the mental health of children is being affected by COVID-19.
I don't know that any new tools have been developed, and obviously we don't have time to test those right now. So I would lean on some of the other tools that we use to assess for mental health and trauma symptoms. So as many of you know, there are so many out there, so I don't want to say any particular tool, but we're encouraging our clinicians right now to just do the best you can and administer those over the phone, whether it's a trauma symptom screen measure that you're using, or just assessment tools for emotional health and well-being.
Okay, great. And you mentioned some new data from the University of Massachusetts as far as reports coming in. Do you know of any other emerging data on incidences of abuse or types of abuse that are more prevalent?
Yeah, there are. I mean, there are new reports coming out every day, and we know the calls to helplines are going up dramatically. It's the calls that Latina was talking about, that reduction. It's not that the child abuse is going down. It's that we do not have eyes on children, and when we do have eyes on children, there seem to be the injuries for physical abuse seem to be more severe. I just saw some data. I can't remember the resource, but it's a more national sexual assault resource, where for the first time in their history, they have more calls from minors to the sexual assault line this last month than they have ever, and more calls from minors than they have for adults, so minors calling in for themselves. And I mean, we don't have any data as far as how a pandemic will impact us, but we have so much data regarding when unemployment rates go up, child abuse and domestic violence rates go up. When substance use increases, child abuse rates go up. And so this is like the perfect storm we have here for maltreatment of children and domestic violence.
Yes, okay, thank you for that. We had a couple questions about using telehealth and adapting other processes for particular groups of children. For example, one person is asking whether the telehealth suggestions would apply for children with disabilities.
Yeah, great. It's a great question. And my advice to clinicians is this really has to be individualized. You can try it and see if it works. And if it doesn't work, then you may need to switch to a different modality or really heavily emphasize the support you're giving to parents at this time. At the same time, we have kids with developmental disabilities who are doing phenomenally well using this platform. And I have to remind myself in my 40s, and I didn't grow up with a tablet and access to this sort of equipment, and kids can work their way around it very, very quickly. Some of the materials we use for youth on the spectrum do involve online learning already, and so those with developmental disabilities may fare just fine using this particular platform. But again, you really want to make sure that it's individualized for your client. For younger children, it's more difficult. I would also suggest shortening sessions if that's more helpful in doing more frequent check-ins rather than a weekly session. Maybe you do two sessions that week, but half the amount of time.
Okay, thank you. And we did get a few questions about specific psychosocial support for the practitioners themselves. Sorry if you covered this and I missed it, but are there any particular sources for resources or tips you can give for the practitioners themselves?
Yeah, I think Zlatina talked about the end. We really need a whole separate talk just on the secondary trauma, vicarious trauma for professionals. So I would circle back with your whatever professional group. I know we have folks from all different disciplines here, so I would circle back with your professional societies and groups or boards that may have ongoing support. I have had what we've been doing here locally is just using an online platform to connect people, to keep us connected, because we know social supports are so important for kids, but they're really important for us as professionals. So we're having to take proactive measures to establish that. So we have a weekly or twice weekly check-in with a number of professionals that we're all working with together on this, just to share resources and even if it's just to vent or to share stories of hope too.
Right. Okay. Thank you for that. We are at time, but that's a good segue for our last slides here. If you do have questions specific for Jessica and Zlatina that they were not able to answer, we invite you to contact them directly or to contact us at ISPCAN, resources@ispcan.org, and we will put you in touch and try our best to get your questions answered. And I also would like to invite everyone to take a look at our COVID-19 resources page on the ISPCAN website, which has a variety of resources for different disciplines as well as for parents and children. And also at the bottom of that page, you will find a forum where you can post comments or questions and hopefully continue this conversation online. And a reminder that a recording of this webinar and a PDF version of the slides will be available on our website at ispcan.org following this event. We also encourage you to become a member of ISPCAN if you're not already, so that we can continue having webinars like these in the future. And if you are interested in presenting or have ideas for topics for webinars, please contact us at resources@ispcan.org. Thank you all again for joining us today, and to our presenters. We hope that you all have a good day or night, depending on where you are. Thank you, Jessica and Zlatina. Thank you, everyone.
Thanks, everyone. Take care.
Okay, you too. Bye-bye.